I want to welcome you to this exciting program. But before we dive in, I want to start with a big thank you to the Sequoia School of Technology for hosting us this morning. For how many of you is this your first time here? Great. How delicious is breakfast? Really good. Prepared by the students in the Culinary Arts program here at the Sequoia School of Technology. I always think this is not only a great way to start the day, but it's a wonderful example of the partnership that we have with the Sequoia School of Technology and an example of the talent that's being developed right here in the community. So today we're tackling a topic that affects every business, every employee, every family, the rising cost of healthcare. It's timely, it's complex, and it's something that we all have stake in. The event comes together through a great partnership with the New Hampshire Health Cost Initiative, and I want to thank Jennifer Frizzell and her fantastic team of health policy experts who are here with us, including Exeter's own Deb Fournier. It has been my pleasure working with all of you, and I'm very much looking forward to today's conversation. Earlier this fall, the Exeter Area Chamber partnered with the UNH Institute for Health Policy to learn more about how rising healthcare costs and employee benefits are impacting our members. Nearly 50 chamber members took time to share their experience, and we are very grateful for their input. This input helped shape the insights in the summary that you have today, and those real-world perspectives will help ground our discussion in what's truly happening across our business community. Conversations like this matter. We have an opportunity to shape the future of healthcare in New Hampshire to make it more accessible, affordable, and sustainable for small businesses and families alike. Now allow me to introduce Lucy Hodder from the UNH Franklin Pierce School of Law, one of New Hampshire's most trusted voices on health, law, and policy, and a key contributor to the New Hampshire Healthcare Initiative. Lucy is going to lead today's discussion, so let's get started and explore how we can work together for a healthier New Hampshire, starting right here in our community. Thank you so much. Sorry.
Thank you so much, Jennifer, and all of you for coming out this morning and being with us to talk about this incredibly important topic. Yes, I am Lucy Hodder, probably the least important person today because we're really here to hear from the panelists and all of you. I direct the health law program at UNH Franklin Pierce School of Law and collaborate with the Institute for Health Policy and Practice and the New Hampshire Cost Initiative. And also, for many years, I was in private practice at Rathyoung and Pignatelli representing employers and healthcare providers on a variety of corporate issues, including their healthcare and their healthcare decision-making, and also many of their HR decisions. So identify with you all and what you are going through, and we really hope this morning can be a conversation. I'm going to just introduce our panelists for a minute, talk a little bit about what we're going to go through this morning, and get you thinking about a few additional topics in addition to the great information you all provided throughout the chamber in response to the survey. You're here because you all are the employers, you are the lifeblood of the community. You every day are making decisions about your resources and what resources go back into your business, what resources go to your employees, and a huge part of that is what resources you are having to commit to the structure of healthcare that we have in this country, which is health benefits for your employees. And it's a tough decision every single year. And I want you to be thinking about, as you're making that critical decision for your employees and for your businesses about how you allocate resources, do you feel like you have choices about what health plan you're able to offer? Do you feel like you have choices about how much that's going to cost you? Do you feel like you have choices about what that plan looks like for your employees, what choices they get to make, what they get to access? And also, do you feel like you know who you can talk to for help, for ideas, so that next year may be different? That's what we hope to talk about today. It's a conversation that we're beginning. If we came here and we told you that we had the silver lining in our back pocket, or we had the shiny red object that was going to solve this problem, we would not be telling you the truth. But we do have ideas, and that's why we have such a great panel to share. I have with me Deb Fournier, who is from Exeter, hails from Exeter, and a huge part of why we're here today. She directs the Health Law Policy program at the Institute for Health Policy and Practice, has a long background in health policy, was the former Medicaid director for New Hampshire, and is going to talk to you a little bit about what's going on in the landscape around costs. Of course, we have Commissioner DJ Betancourt from our New Hampshire Insurance Department, who is living and breathing the issues around insurance every day in this state, and all that means. And I think we have AJ here as well from the Insurance Department. I don't know who else we might have from the Insurance Department, but thanks for coming. AJ is going to tell you that there are consumer resources and employer resources available. Cass Walker. Hi, Cass.
Hi.
She is the Chief HR Officer at the Greater Seacoast Community Health. So both a provider of essential services for the community, as well as making tough decisions about HR and coverage yourself. Ryan Poplaski. Hi, Ryan.
Hello.
Who is a physical therapist with Body Wise Physical Therapy and Wellness. Has locations in places that he's going to tell you, but in this community, and is both experiencing the tough decisions around healthcare as well as healthcare delivery in an ever-changing environment, as we see so much changing in the delivery system that we're in. So what we're going to do today, anybody have any questions before we start? And just note, when we do engage, we really want to find out a little bit more about you, who you are, what you're going through. That's what a really important part of today to share. So I'm going to start with Deb Fournier. If you could come and tell us a little bit about just what's going on in the big context of health costs. We know they're going up. We know they're a huge, intense pressure. Why and what's going on?
Thanks, Lucy. Good morning, everybody. Bear with me while I do the login. My name is Deb Fournier, as Lucy said, and I am, in fact, the Director of Health Law and Policy at UNH's Institute for Health Policy and Practice. Lucy left out one key component, is that she was the inaugural person who created that position at IHPP, and so I am following in her vaunted footsteps. Can you guys hear me?
Yes.
People are like, meh. Oh, it does work. Okay. So I'm here to share with you what the results of your survey said, and to put it in the context of what we know about what's happening with respect to healthcare decision making in terms of healthcare benefits and at the national stage and locally. So your survey, some of the really important things that you told us are that healthcare costs are a major concern for you, that those costs are making it hard to retain and recruit new staff. You told us that about half of the folks who answered the survey offer family insurance to their employees. Another 17% offer only employee-only coverage, and the remaining third don't offer coverage at all. And then they shared with us the figures of what they think they're spending on average individual premiums and family premiums. That's their component of the cost. That's not often the total cost. There's often employee contribution to that. So the concern about healthcare costs is not happening only here in New Hampshire. For the last 5 decades, we have seen annual average increases that have been no smaller than 3%, but sometimes have ranged as large as a 14% increase. So this is not new, it is not sudden, and it is not only here in the Great Granite State. This is something that every state in the Union is struggling with. The primary place that we see those expenditures are hospitals, physicians, and drug expenses. There's a whole symposium that we could do, and we have done, on rising healthcare costs and the drivers of those costs. I urge you, we have a symposium coming up on the 20th of November at the law school. Lucy will be one of our primary speakers. I urge you to come and learn more about that conversation, about the invisible forces that often impact healthcare costs that we don't spend a lot of time on, and then some reflection of what the state's initiatives are that continue despite and amid the current context. So, hospitals, physicians, prescription drugs. So, what does this mean in terms of offering health insurance? So, what we know from the last 20 years, the chart on the left is from the Kaiser Family Foundation National Employer Health Benefit Survey. And large firms are more likely to offer health insurance, and smaller firms are increasingly likely to drop their insurance. We had one respondent in the survey who wrote very plainly, we can't offer it because it's too expensive, it's too high. And again, I want to repeat that of the folks who responded to the survey, fully a third said they don't offer any health benefits at all. And that only half of them can offer coverage for their employees and their families. The costs are impacting employees too. This survey is a national survey about how people are managing healthcare costs, and the headline from Kaiser is that 3/4 of uninsured adults say that they have skipped or postponed care because of cost or concerns about cost. What I want you to look at is that 37% of the people who are insured, right, those have said, I'm not going, or I'm delaying going because I'm not sure about those costs. That is a really new trend. The last time I gave this presentation, that figure was 25% of the insured said that they were concerned and not going. And now, and this was in 2024, so before the most recent developments in terms of anticipated cost increases in the individual marketplace came out, right? So it's not only on the employer side. And even when they have employer-sponsored insurance, this is also from the Kaiser Family Foundation Health Cost Center. These folks on this survey said, I have ESI and it's not good. ESI, employer-sponsored insurance, used to be the gold standard for insurance. People considered you all set if you had employer benefits. And this reflects that people are marking those insurance plans as fair or poor. And again, I want to reinforce that in the results of the survey that Exeter Chamber took, folks said very plainly, like the cost of healthcare impacts who we can hire and who we can keep. We got to hear a little bit about what the deductible levels are in the plans that the respondents to the survey are offering. And the survey from Exeter said, you know, the majority of folks that offer plans, their deductibles were around $2,500 or more. That is very consistent with what we're seeing in the New Hampshire small group and large group markets, in which the vast majority in both markets, in small group and in large group, deductibles are $3,000 or more. So very much in line. And then the pain point that I think a lot of employers feel, and that you guys told us, a third of you feel, is that health insurance premiums are going up higher than earnings can go up. A third of you told us you can't make decisions about increasing wages that you want to because you're footing the bill for the cost of health insurance coverage. So I'm not here to, please don't shoot the messenger. But really what I want to point out is that your responses to the survey are completely in line with national and state figures. And that, as Lucy said, part of what we want to do here today is to understand more about your circumstances and have conversations about where you think your options are and where you think you can go to improve the situation that you find yourselves in. So I'm going to limit myself there. And Lucy?
Thank you so much, Deb. Really helpful to hear, also really sobering to hear, and why we're here today. So I want to start with you, Cass, and ask you to tell us a little bit about who you are, what type of organization you work at, and what recently have been the decisions you've been making around health insurance. What is your experience?
Sure, thanks, Lucy. Thank you, everyone. Great to be here, great to be part of the conversation. And as was mentioned earlier, I'm not suggesting I'm gonna have any answers, but I love the conversation and love to partner with people so that we can all learn together. I work at Greater Seacoast Community Health. We are a community health center. We're also referred to as a federally qualified health center, which means we do get significant dollars from the federal government to support our centers. We have one in Somersworth and one in Portsmouth. So we have a catchment of roughly 15,000 patients that we serve. And we have pediatrics, primary care, prenatal, dental, behavioral health, as well as wraparound services like social work, family resources, that type of thing. So, and for me, this fits well for me. I've been, I'm getting, maybe at some time I'm aspiring to retire, but we got a few more years than that, I hope. But with that being said, my entire career has been in the nonprofit world. Came up from Massachusetts, and when I was in Massachusetts, I worked about 24 years in health and human services, and then in the hospital systems up here. And I am happy to be in the community health centers. So nonprofit, as I mentioned to Ryan earlier, is kind of in my blood. And so, for me, the challenges of healthcare, of healthcare for our employees, as well as healthcare for the people we support, is a constant daily challenge for sure. And so for us as an agency, like many agencies and organizations, we're all going through change. We have been on a change in this last year with a significant change in our leadership. We have a new CEO, Dr. Jocelyn Capel, who came in to us. And one of the things she said to me when she came on board, and of course I'm always in that unique position from an HR perspective, is I'm bringing a new leader on board, and at the same time she's then saying to me, okay, here are the things we're going to do before she's even hit the ground running. So one of those was when she looked at our health insurance, she said, we gotta do better. We absolutely have to do better for our employees. I would echo what we saw here. The cost of insurance, especially for, in our case, we have people who earn $19 an hour. That is not a living wage. We all know that. And so when you are trying to provide for them not only their own insurance, but insurance for their families, quite honestly, we have to get very, very creative on how we can help support them and help their families.
Thank you so much, and I'm just gonna leave you with I'm gonna have it passed down. So what's gonna happen is I'm gonna have to, each speaker is gonna say a few words, and then I'm gonna fire questions at them, and then I'm gonna let you fire questions at them. So thank you so much. Did you say how many employees you have?
We have 229.
Okay, 229 employees. Thanks so much. Okay, Ryan, can you give us a little bit of a background as to the size of your shop and what you do in the community and where? And tell us a little bit about your decision-making around health benefits.
Sure. With Bodywise Physical Therapy, we have 2 locations, one in Epping and one in Stratham. We have just 15 employees. Some are part-time, some are full-time. We've been around since 2007, and we've seen a lot of changes within the healthcare world, but also in the small business world too. And I hope to represent small business well today. I feel like we are well represented within the survey. A lot of what you see there is what we live day to day. And the decisions we have to make each year really depend on healthcare costs. And there's a lot of, I would say, guilt not being able to provide the healthcare that our employees deserve because the fact that it is a higher cost out of pocket for us, that being a small business.
Thank you so much, Ryan.
Yeah.
So we have a very small employer and a larger employer, but facing the same realities of year after year, there are costs that are going up and what kind of squeeze that puts on you. And also you said you're seeing a lot that's going on in the community that's changing while
Yes, I
that's
mean,
happening.
in preparation for this, I talked to a few other business owners, some small business owners, some healthcare small business owners, and those who aren't in the healthcare field, and it's universal. It's not just what I'm seeing. I think that the survey represents Southern New Hampshire, especially this area, very well, and what the small business is experiencing year to year.
So I'm going to next turn to the commissioner, who has the unenviable task of seeing the entire system and what's going on, having some really important touch points in some areas and very little in others, like what's going on in the provider consolidation and the actual delivery system that's happening. Also remember that the insurance department regulates fully insured products, but doesn't have nearly as much control over the self-funded world. And so the commissioner is trying to keep the insurance markets at least partially competitive, unlike in some of the states around us where there's really only one dominant payer, while also hearing the stories of how much the increases that are happening are impacting you every day. So with that wonderful task, I'm going to turn it over to you and give us a little good news and a little bit of realities and help.
Well, I think that's a G thanks, Lucy. It is absolutely the case. This is by far the more enjoyable, way more enjoyable of my events today. After this, I have to go up to Carroll County to talk about Medicare Advantage. I imagine those folks are not going to be all that thrilled to hear me and see me, though, to Lucy's point, unfortunately, it's something we have absolutely no control over. It's a federal government program. But, you know, I sit across the table from small business owners on a nearly daily basis. I mean, Lucy is not exaggerating when she says that I live this all day, every day. That includes the fact that my wife is a small business owner. She has a mental health practice in Salem, the community that we live in. And so I hear about this on the weekends and at night. Every night before I go to bed, I hear about this. So I certainly understand in a very intimate way the challenges that all of you are facing. You know, when your health care costs, the cost for you to provide coverage to your employees is rivaling your payroll, it is an incredible challenge, and one that, as I said, I can very personally sympathize with and understand. I do try to bring good news. I try to be optimistic. It is, I think, part of my nature. And so what I can say is that New Hampshire is certainly much, much better positioned with respect to the health of our markets than nearly the rest of the country. Now, make no mistake, I'm going to try to bring you more than just, it could be worse. I am going to try to share with you some thoughts and ideas as to what you can do, the steps that we can take to try to contain costs and bend the cost curve. But New Hampshire, I think, takes a smart and pragmatic view. We cannot always control the national trends that we're up against. We cannot always control some of the horseplay, I think is the cleanest way to put it, that takes place down in Washington sometimes. But we make the very best of our situation because we've got good, solid fundamentals in terms of how we approach overseeing and regulating our markets. We have unbelievable advantages here in New Hampshire in terms of quality of life metrics, being at the top nearly across the board. So we come into this with some advantages that we try hard to leverage. Our small group market, for example. We're not immune from the fact that our small group market is shrinking, but it is shrinking at a significantly slower rate than what you are seeing in the rest of the country. So while we cannot fight back necessarily against the principles of adverse selection, that creep into the small group market once population shrinks and you don't have as deep or as wide or as diverse a risk pool. We have been able to provide information and incentivize small businesses to be able to stay in the small group market. We've been able to work with our carriers to get them to continue to remain in that market. There are states across the country who are losing carriers left and right out of their markets. And so you don't have that competition. You don't have the options as a small business owner in a lot of other states that you do here in New Hampshire. I think looking forward, one of the things that is really going to be important, and we're going to have to work collaboratively together, and we're all going to have a role in this, is we're going to have to innovate. Because the traditional tools of the past, in terms of how you would stabilize a market, are just not feasible or practical when it comes to the small group market. I'm asked all the time, Commissioner, have you thought about changing the attachment point in the small group market so that we can promote more businesses going into that market as opposed to going self-insured? And I say, well, in principle, that sounds great. But the trouble is, if I start pushing or forcing more small businesses into the small group market, and that market isn't affordable, you're going to have all those small business owners showing up at the State House and at my office with pitchforks and torches. They're not going to be happy. So we've got to do something to bring the cost down so that if we change the attachment point and edge those people back into the traditional small group market, it's going to be something that they can afford. It's going to be something that's going to be viable for them. So I'm asked, well, why not a reinsurance mechanism? I know we're going to talk a little bit about the success that New Hampshire has had with our reinsurance program in the individual market. Again, in theory, great idea. How are you going to afford that? How are you going to fund that? And it is of such a cost, because we've looked into it, that it would take some significant support from the federal government. And I'm not sure if any of you have noticed, the federal government doesn't really have their act together these days. So I'm not holding my breath that any relief from Washington is coming. So it's going to take some innovation. It's going to take embracing of some new models, some new ways of thinking about things. I know that for a lot of small businesses, the ICRA model, which is to say you've got a pot of money, you give your employees that money on a pre-tax basis, they take those dollars, they go onto the individual market, they purchase a plan. I still think that for a lot of business owners, that may very well be a good solution. And we'll talk a little bit, I know, about our individual market. Again, we're not immune to the challenges. We're facing those challenges. But there again, I can say that for all of the noise and the chaos going on at the federal level right now, New Hampshire in 2026 will continue to have the lowest average monthly premiums in the individual market. Is it going to be affordable for every individual and family? No. Is it going to be affordable for every business owner that is going to go the ICRA route? No. But we do have that advantage. And for some small business owners, that model is going to work well for them. So again, we'll talk about some of the steps that we can take, some of the innovations I think we're going to have to consider. But when you look at the overall situation, while not ideal, New Hampshire is in a far more advantageous position than the rest of the country, which means that we've got the ability to not just manage crisis, but to actually also think about how we innovate and move forward.
Thank you, Commissioner. I'm just going to say one thing, just to level set, in case we need it, and you all can wave your hands if we need it more, or tell me to be quiet if we don't.
But you've talked a lot about the different markets, and I wonder if we could just down the line level set as to what we're talking about. Many of you may know this well, but if you're securing health insurance for your employees, you may be a large group, right, which we have at the end of the line, and we have most of our employees are insured through large groups, a majority. And many of those in the large group market, and we call them markets just because they're a large group, are self-funded, right? Which means that they actually probably use a captive, and we're going to ask you in a minute, Cass, what that means. Then the small groups are very different. So, Commissioner, I'd love for you to tell everybody just exactly how we support the small group coverage. It's dwindling, but it's still got a lot of supports that are different than what happens when you're a large group. And then, of course, we have our individual market, which is now through healthcare.gov. You can be either an ACA product or there's some variations on that, but that's where you can get your individual coverage in a big risk pool of insurance carriers on our federally facilitated marketplace, which the ICHRA plans do allow for people. And there's been a lot of focus on the individual markets. We're going to talk a little bit about how they're threatened right now with a lot of the politics. It's impossible not to talk about the politics, but our individual market, despite the incredibly hard work that's been going on, is very threatened. But I want to just, Cass, ask you to talk a little bit about what it's like being a large group employer, what that's meant for you, and what kind of choices you've had in that regard.
So with regards to, from a large group employer perspective, we actually have been in the individual market. So we have been on an ICHRA plan for 2024 and 2025. And from an employer perspective, quite honestly, it was a significant cost savings, no doubt about it. What we continue to struggle with is how to, and quite honestly, with what's going on now, we felt very unsteady to continue in that market.
Can you explain a little bit more about what the experience of your employees was on the ICHRA plan and what you're referencing as to what's going on now?
Sure, absolutely. Thanks, Lucy. So so what our employees were experiencing is that they were fine within the ICHRA market on the individual plan. We also offer a +1 for spouse or partner. We offer an employee plus family, and we offer a family plan. Those were the three key areas that within the market it was difficult for our employees to be able to bear the cost of that, as well as especially for employees who were needing to seek services. So we have employees who are residents of Maine, Massachusetts, and New Hampshire. So for Maine and Massachusetts, they had a broader spectrum. Understandably, New Hampshire, we can't always do that. And so it was a challenge for our New Hampshire employees when they didn't have an opportunity to seek some of their services outside of the state. That was certainly an issue for them. What we did as best as we could is we funded as much of that plan as we could for our employees. So for example, we had two plans. We had a plan which was a traditional HMO. Then we had a plan that was also for an HSA. For the HSA, the organization we funded part of the HSA and had no premiums for those people. We were hoping for them to work towards funding HSAs and having some more long-term security within their benefit long-term costs. And then, and the HMO, there was a small premium for which we then funded a substantial part of it. We funded about 80% of it. We have chosen to go to a self-insured plan with a large captive. So it's a national captive that we're going to. We are hopeful that having a broader carrier to be able to meet the needs of our families and our individual employees, that they'll have more options. And we also, within that plan, have gone in a different direction with regards to premiums. So we have gone to what's referred to as wage banding. So the more you make in our organization, the more you're going to pay towards your premiums. So that the people, as I mentioned earlier, who are our lowest paid will have the best benefit and best opportunity, not benefit, but best opportunity to pay the least amount with regards to their premiums. We were also able to work on our deductibles, so we were able to bring our deductible down to $1,500 with a family deductible still at that $5,000, so still a real pain point for our families.
Wonderful, and we'll talk about deductibles in a minute because they are sort of the rub for your employees, and a lot of the risk gets shifted to employees as the costs go up, which is a real concern. So Cass, can you tell us a little bit about when you were operating the ICHRA and making those decisions about how much to fund the HSAs? how much of the premium to take on as the employer, how much risk to transfer, what it might mean, what type of plans were available, who was helping you? How did you make those decisions? You know a lot about healthcare. What would you do if you were someone who did not?
Yeah, and to be honest with you, there's a couple of things, and Ryan and I talked about this earlier. So, yes, I've been in human resources for several years, but for any of my other HR colleagues that might be out there, we're not always experts in benefits. So we really relied on a broker because we really needed to be able to have some assistance in guiding us through the process, helping us understand what it meant for us, going through the various models of, okay, if we're paying 14%, what does that, or if our employees are paying 14%, what is that going to mean for them? What can we afford to do? And this was a strategy that was in place for a good year in talking about it with our senior leadership and our CEO to make sure we could get to that point. So that was a lot of it. And then educate with our employees. A big part of it, which I don't know about the rest of you, but I never feel there's enough that we can get at.
Right. And how did you find your education was working with employees? And as you switch now to a different type of product, what is that taking from your resources to engage?
Yeah, I don't know about you all, but we just literally did open enrollment started yesterday. So, so we're at it 24/7, trying to get everybody what they need. I would again lean into having the benefit of a broker. It's a cost for sure, but by the same token, it gives us the expertise we need as we're going through the compliance portions of it, making sure that we're dotting our I's and crossing our T's on every aspect of the insurance plan. And then the education is also going to need to be leaning into, to a certain extent, our broker as well, because we have employees who are converting over to Medicare. We haven't, so we've got to make sure that there's some specialty areas and the broker is helping with that. But my benefit, person, who I would like to be able to say she's a generalist and can help do with some other things within the HR component. Nope, she's 100% doing benefits right now and probably will be for a while as we educate, because that's the other thing. The plans are so complex that we need to help our employees understand. For example, let's not have you go to the emergency department. Let's have you go to urgent care so that you're paying a lower cost. You're not going to get hit on these expenses. If you need to have an MRI, where can you have that done? If you need therapy services, where can you have those done? So that there are opportunities to help our employees be educated and understand how to save costs everywhere that they can.
And we're going to go more into that. Thank you so much, Cass. I have one follow-up question because it sounds like you've really dedicated resources internally to understanding that this just doesn't happen. It's the broker engagement, but also a real commitment, it sounds like, from top down and bottom up around this as something that needs to be a cultural shift.
100%, and I was, as I mentioned, the wage banding earlier, one of the areas that got hit most, quite honestly, was for our physicians, our associate providers, and our behavioral health specialists. So I've been meeting with them in small groups to help them understand why we're doing this, and they get it. We're a mission-based organization. They understand that if they're the ones earning the most in the organization, they should put a little bit more teeth in the game for their premiums, and they understand that. But it's still, let's face it, it's a hit to everyone's budgets. Everyone has to adjust for that. And one of our providers asked me yesterday, he says, well, but can we at least keep this plan for a couple of years so we won't have another change and another mode of education we have to go through? And I said, I can't guarantee that. We have to continue to assess, plan, make sure we're in tune to what's going on, having conversations like this, learning from each other to see what we're doing to improve what we can do for our employees.
Thank you so much, Cass. Brian, can you tell us a little bit about the world according to the small employer that you are, and just what you have felt your choices are? Did you see the same options that Cass has seen? What have your choices been?
So we feel that, or I feel personally, and I talk with other business owners too, that our choices have drastically decreased. In fact, personally, our health insurance plans, in the last 4 years, we've been dropped because they've been phased out. So this year we have to choose a new plan moving forward, which is not as, if you look at the premiums, it's going to be higher with higher deductibles. And that's the biggest change that we see, is that we don't have the buying power to buy into the better plans. So we're stuck with higher premiums and higher deductibles for our employees. Now this is troublesome for our employees, but also troublesome for the business in the fact that we have trouble attracting talent because of health insurance. It's one of the biggest questions I get asked during the interview is, what's your health insurance like? And I would love to say that we have a great health insurance. In fact, compared to other physical therapy clinics, we have some of the best health insurance that we provide for our employees. But we would not be able to provide this health insurance that we provide if all our employees decided to take that plan. So we are providing for a few of our employees that have decided to go on that plan, but we could not afford to provide that for everyone, which is not a great situation to be put in. But also, going back to attracting talent, that's a huge crush for us because we need to be able to compete with some of these larger corporations who are able to afford better plans, and we just simply can't because of what we're being offered. I hope that answers your question.
Yeah, that absolutely does. And I'm going to jump into sort of the other big bad world of healthcare and healthcare delivery, because you have a really interesting perspective, both you and Cass, on that, which is you're also a low-cost independent provider. So if you can't make this business a survival strategy, mean you have health insurance and you can attract employees, you might not exist as an independent provider. Tell us a little bit about what your business choices are and what you see in the healthcare delivery system that may be the result of your choices for those around you accessing affordable coverage services.
Yeah, I think that's a great question. And really, we are part of the solution as independent providers, as small business owners. We look at healthcare costs overall. If you look at the larger conglomerates, the monopolies in the state, independent providers will provide the same care at the same quality, 2 to 3 times less than some of the larger corporations and hospitals. That's huge, not only for the people utilizing care, but also the insurance companies too, who are having a less of a it's not as big of a hit for them. And I think that's something that a lot of people don't understand, that it's something that more people should really look at and dive into their healthcare, not just employers, but the people utilizing the healthcare and we should have clear and concise payments where we know what we're paying at each facility. But yes.
Thank you, Ryan, and feel your pain. I don't know if anybody's checked the health cost website that the insurance department operates, and Commissioner, I'm going to ask you for a minute about some of your transparency efforts. But if you go on there and you pick, any outpatient service, and you look at the spread between the cost at some places and the cost others, it's sometimes 500% fold, if not more. And that's what Ryan's talking about, which is if Ryan can't make this decision for his employees and survive as a business, as an independent, it doesn't just affect your business, and you might have to go to a higher cost setting so that you could survive, which is what we're seeing throughout the healthcare system. A lot of services have to migrate because it's where systems are going, to big consolidated delivery systems. But sometimes it's because it's impossible to survive in the real world because of the very costs. So
yeah, and one more thing, I think that's a good point that you bring up, is that a lot of small businesses are becoming kind of eaten up by the larger corporations because they have to survive, regards to health insurance, regards to reimbursement, those type of situations. And what that does is it creates increased administrative costs overall, and just leads to increasing costs for the people using those services.
Commissioner, can you talk a little bit about what what transparency initiatives you've taken at the department around the issue of cost?
Absolutely, and Cass, by the way, set the table so incredibly well for what I plan to say next. So I'll start by saying ditto to what she shared, and I'll build on that a little bit. So in Cass's story, again, I'm going to circle back around to the small group market. It was very, very illustrative of the challenge there. So she began with the ICRA plan, and that was very attractive at the time because the federal government has injected a lot of financial supports into the individual market. The state's reinsurance program has worked incredibly well. So from a financial standpoint, that was attractive. Additionally, it removed some of the headaches of trying to choose a plan for sometimes a very diverse set of employees. So there was a lot of attractiveness there. Then some challenges moved into their dynamic, and they went into a self-insured arrangement, which again is attractive to a lot of employers because they have more control. They can bring different strategies and innovation and flexibilities. You have to have a good TPA, of course. You have to have a good cost containment strategy. But what was missing in between her ICRA arrangement and the self-funded arrangement was any consideration of the small group market. And therein lies the story of the most prominent challenge with the small group market, which is it is being eaten away on both sides. On the one hand, it's being eaten away by the attractiveness that states and the federal government have injected into the individual market, and it's being eaten on the other end by self-insured arrangements. And so that is a big part of why that market is shrinking. So Cass talks a lot about, the most successful cost containment strategies begin with education and culture. And I could not agree with that more. And I think that is where the transparency measures that we have undertaken as a state, really for over a decade now, allow for all of us to get educated and use a different strategy that can start to bend the cost curve. Now, I'm very proud of the health cost website that our department designed and maintains. We're growing it each and every year. It is a website that has captured hundreds of types of services that people across the state need. You can go onto the website, you can put in the procedure that you need, you can put in your particular insurance coverage, and then the last question is, geographically speaking, how far are you willing to travel potentially for a lower cost service? So if you need a hip replacement, you'll put hip replacement, you'll put your insurance information, and then if you're willing to travel, let's say 50 miles, you can put that in. And what the website will do is to create a big circle in a 50-mile radius of all of the providers across that geographic circle and show you the list price for all of the hip replacements and the cost of those hip replacements at those facilities. It is a very, very powerful tool. If it is going to have the type of cost bending effect that we all want it to have, however, we all have to make a greater effort to use it. It cannot be the case where, a couple of employees use it, but that's it. There has to be a culture by which we're going to shop smartly. And I know that people get a little uncomfortable when you start talking about healthcare services as a bit of a commodity. But when you're talking about cost, you have to have some of those principles. I use the analogy all the time. If you are in the market for a new refrigerator or a new television, you don't simply walk into the first store that you come upon and buy whatever it is you need there. We here in New Hampshire, it is proven by many studies, we are wicked smart. And so we shop and we take a look around and we try to find the best value for the best price. And we need to adopt more of that mentality and culture when it comes to where are we going to get the care that we need. Because in doing so, in incentivizing and encouraging people to seek out lower cost options, again, if we ingrain that in the culture and move at a rate that is far larger than we are today, we will see the benefits of that cost bending power that comes with transparency.
Thank you, Commissioner. And really appreciate the conversation. And Deb, I'm going to ask you to offer a little bit more insight to the transparency around the care that you have a choice may be helpful. And the department has done so much to make that choice available to try and find the lower cost providers. But what happens around the huge, massive part of the care where you don't necessarily have a choice? There's the inpatient, outpatient hospital system of care. We have incredible hospitals in this state who are providing a significant amount of care, and more, some because simply the providers in the community can't make it on their own. But Deb, tell us a little bit about what you see happening in the costs of inpatient, outpatient hospital care, and the inpatient in particular. Where do you go to find out what the costs are, and what are you seeing?
So, as my slides may have indicated, prices are going up everywhere. As the market becomes increasingly consolidated, as the hospitals join together and join larger systems, they have more market share. So for inpatient services, the prices just continue to go up because that consolidation breeds more consolidation, because the hospitals still want to compete with each other. And if there's some entities consolidating in the market, then other providers who might want to survive say, well, I have to go join a different consolidated entity in order to stay vital and in order to stay in business. And the difficulty, you can go to the health cost website and look for your particular procedure, and you'll see like the range of prices depending on the location and depending on your insurance product. I think part of the difficulty is that what providers are in network and what providers aren't in network is not necessarily at the control of the patient, of the end user. So I can go and shop for, I'll go, have my service done at Wentworth Douglas, but, and this is I'm making up facts now, but Wentworth Douglas isn't in our network, so I couldn't go there, even if I wanted to, right? And so it doesn't necessarily place the flexibility at the decision point of the person who is bearing the brunt of the decision and some of the cost, right? Because they're not dictating who's in network and who isn't. Lucy, does that answer your question? Do you want more?
What is the impact of some of the consolidation been, and what do we see in hospital prices?
Right, so hospital prices, consolidation drives healthcare costs up, and the more hospitals consolidate, and we've had many in New Hampshire, the higher the prices are, because the bigger you become, the more market share you control, and the higher the prices are that you can demand. I think I want to say, so we have 26 hospitals in New Hampshire. Half of them are critical access hospitals, so 25-bed rural hospitals that have somewhat special status from the Centers for Medicare and Medicaid Services, and then we have PPS hospitals, the other 13. At this point, we are so consolidated that I think we only have 5 independent hospitals left in New Hampshire. Everybody else is consolidated. And we have seen prices in the hospital arena go up the fastest and the most over the last 50 years. So as those trends continue, because again, smaller independent providers are trying to remain competitive, and so they're joining other larger, already consolidated prices. The prices just continue to increase and increase and increase. Hospitals are not the only player in this field. Prescription drug costs are also skyrocketing, and at this point, their rate of increase is going up faster than hospital costs. Increases are going up. And we've all seen, I'm sure for those of you who look at your data experience and understand what your staff are what kind of services they're utilizing, I'm sure you're seeing the price hit of those specialty drugs like the GLP-1s. So there's a lot happening behind the scenes that has very little to do with the choices that an individual consumer can make. But I want to point out what the commissioner said about the onesie twosie won't work of people being really conscientious and choosing the lower price location. But it is that kind of thinking about how do you put that power in the hands of the people who sponsor the plans, so that they can say to their people, if you choose from among, these providers, we can ensure that premiums stay at this level. I mean, ideally, you'd be able to say premiums come down if everybody uses this narrower network or only these particular groups of providers that we have established relationships with. And in some, sorry, I'm getting a little off track, but in some markets, we are seeing employers or contained groups choose to do their own rate setting with the providers as a way of guaranteeing to the people that they cover that they will have a certain amount and not more than a certain amount in premium and out-of-pocket costs. Those are very nascent. They're just starting. They're often referred to as reference-based pricing, and it's not an easy, I'm not suggesting it's easy or simple, but it is that principle of like giving the control to the plan sponsor to say, we like the prices of these providers. These are going to be our providers, and we're going to direct everybody there, because that way we know that we are in, have some kind of equilibrium about what our risks are and what our costs are.
Thank you, Deb. So again, engagement and around an issue that's really tough because, you expect the delivery system to be delivering the best care at the most efficient price to you to select from in your plan, but that's not always the way, and that's a hard investigation and a hard conversation and requires a lot. And Cass, I'm going to turn to you and ask you a series of compound questions, but what Deb just brought up, which is the incredible increase of the cost of specialty drugs. We love innovation, we want innovation, but we know, and I do life sciences, I've been tracking this for a long time, we knew this was going to happen, right? We knew this was going to happen. We know the trajectory of the innovation and the change and move to specialty drugs is going to be most of our spend. It may already be, it's going to be even more significant in the future. This is not going to change. This GLP-1 scenario is going to happen again around something else. And it's a huge amount of cost that was entirely predictable, with very little power in local communities to change how the drug delivery mechanism and the prices that we see are there, right? So how do you put your arms around this as an employer who has to make really tough decisions around your prescription drug spend? You also happen to be a wraparound, incredible primary care, low-cost provider yourself. So tell us a little bit about how you use that expertise to make decisions that may help your employees to access the care they need, but at prices you can afford. I told you it was going to be compound.
Thank you. Hopefully I get it all. Keep me honest on it. So, couple of things with regards to that. I would say with regards to when we're looking at things like the specialty drugs and that type of thing. So again, in my mind, in the nonprofit world, as I mentioned, we try to say, okay, what resources do we have from within that we can support? So we do have our own pharmacy. It is a 340B pharmacy, which means that we get some additional benefits based on that status. And so we try to drive our employees to that market as well, because they're going to get that benefit. By the same token, with regards to the formularies or the specialty drugs, one of the things we did in preparation for 2026 was GLP-1s was one of the hot topics. What are we saying about GLP-1s? Well, we wanted to expand the diagnosis group for people to get GLP-1s beyond, let's say, diabetes diagnosis. That was going to increase the cost substantially. which we would have to have shared some of that with our employees. And we chose that we wanted to keep deductibles lower. We wanted to keep some of those other more important things, at least to our knowledge, lower so that we could, again, manage the costs. So we said on GLP-1s that only for people with a diagnosis of diabetes. What will happen for us as part of the self-insured plan is we will have redacted information on what our employees are using come next year, which will give us an opportunity to be a little bit more educated on, are there more cardiovascular diagnoses going on? Are there more diabetes? A little bit more information so that then we can have another discussion about, okay, what can we, based on the employee need to consider opening up for people so the costs can potentially go down, again, up to next year. The next thing we did was and I certainly, having been in the hospitals, know hospitals do this as well, we're driving our cost, we're trying to lower our costs for our employees when they're coming, what I refer to as domestic, when they come to our services. So an employee, I could have a provider outside of Greater Seacoast Community Health, and I can pay my $30 copay at my non-preventative care visit. However, if you come to Greater Seacoast and you are an employee, you're going to pay $10 for that same visit. So those are some of the other ways that we're trying to drive the costs. Did I get it all?
Yeah, I think so. And you mentioned also you might be using an HSA for some of the choices.
Yeah, we had been in the individual plan. We are not in the self-insured plan. That was not, we didn't have an option of that. So again, that's where some of our options were limited. Yep.
Right. I've heard of the lifestyle spend accounts.
Yes, exactly. And we do have an EAP program as well, that, behavioral health is something we haven't even touched on, I don't think yet today, but that is a significant challenge, I think, for many of our employees. And so we use EAP services because they get 8 free mental health services, 8 free sessions per instance per year. So we do try to do those things.
Wonderful. Thanks so much. That's a lot. We're talking about EAPs, we're talking about using your own, what you know about healthcare, and then also trying to get your arms around the drug spend. So I'm going to be turning to you all for questions. I think what's the mechanism? We have note cards on the tables, but I'm also just happy to have hands raised, which would be really great. Who else wants to jump in on the drug costs issue? No one. Okay, do we have some questions?
I
From-
think I would jump in on confusion.
Okay.
So I think that's the big thing right now, like for my business, because there's a lot of confusion around the insurance plan, what we offer, and so.
Just tell us who you are and what you're,
Sure.
where you come from.
So my name is John Morrow. I'm the Herbal Path Natural Pharmacy. We're a small pharmacy in the Seacoast, Summersworth area. What sort of resources are out there for our employees on cost of care?
That is a really great question, and I think I'm going to give that to Deb first as to what resources are available around costs of care. We've talked a little bit about transparency options. We've talked about going to the health cost website. We've talked about maybe Ryan or Cass, you can talk about what you can learn from your broker about costs of care and how you can use education. I don't know if either one of you want to take that question.
We'll share now. Okay. So I do think the broker is a big help with that, and because they truly can get us some care management or case management support in the sense of here's the unique situation. And I'm going to use an example that is not one of my examples, but of a colleague of mine who has a similar type of insured plan, a self-insured plan, and the relationship with the broker. So I don't mean this is unique to self-insured, I just mean with the relationship with the broker. They had a employee situation where the significance of their medical event was such that the specialty drugs was just an incredible cost. And so this particular relationship that my colleague had with her broker was they were able then to go to beyond our United States market and check into the European market to see what they could get for reduced costs of those drugs. And the employee had to agree to that, but when the employee agreed to that, it's saved literally hundreds of thousands of dollars. So those are the things that we would know. None of us would know those things. So when we can go to an expert or go to a group of people who can, kind of dig into that for us, I think that is a big help.
So, can I ask that follow-up question? Yeah, yes.
So do you mean your folks don't understand the policy that they have? Or do you mean, like, is the confusion about, I have an insurance policy and I don't know what that's gonna end up meaning for me financially?
I
Or
think
do you
there's a
mean, like-
lot of change.
Yeah.
Because we're in the process of selecting new plans for
Yeah.
next year.
Yeah.
We're working with a new broker who's
Yeah.
been more helpful than our old broker.
Yeah.
But recently, it seems like there must have been a change or something, because we've never had employees come ask us about the coverage, right? And
Right.
now I've had 7 employees approach me over the last 2 weeks, asking me about what we offer. They know it's a high-cost plan. They know we don't do a lot with reimbursement. I'm kind of capped as a small business with what I can offer.
Yeah.
And I feel like I feel bad because I want to offer my employees more, and we're a health care organization, so we should be doing right by them, but that I'm limited by the constraints
Right.
of being a small business. So I really identified with what Ryan was saying.
Yeah.
But there is a lot of confusion. There's confusion for me too, because I don't understand all of the nuances of our plan and where to get that info, and so I'm just trying to kind of tiptoe around answering the question. So I think some of the tools that I've heard about today, I didn't know existed.
Yeah.
So is there like a central repository where I can go get that information?
The employee toolkit concept.
Right, I would love that.
Right, exactly. Right, how do you use your deductible? What does it mean? Right, what happens to the
whatever-
formulary you
whatever.
thought you had when it changes after enrollment?
So I hijacked it. Well, I was handed the microphone.
I thought you'd be the first person to
It's always dangerous to hand me the microphone. You raise a lot of important points there. In terms of the toolkit, again, our health cost website is a tremendous asset for you. We have right on that website the employer's toolkit, which will take you through all of the considerations along the lines of what you've described. You asked the question, kind of what has changed, and I can tell you, globally speaking, I think a big part of what has changed are the expectations that this current and future generation of workers are expecting in terms of benefits from their employers. This is not the mentality of my parents' generation, where they stayed in the same job for most of their career, if not all of their career. The big attractive part of it was at the end of their working lives, they would have the pension and they like stability. This generation likes to move around. They value work-life balance. They think about what are the benefits that my employer is going to offer me. And when we talk about New Hampshire's overall economic situation, we talk a lot about workforce challenges. And the way that we're going to attract and retain the workforce that we need to be able to grow our economy and be successful in the future is by being more aware and receptive to the types of things that this generation is looking for in terms of what their employer is going to offer them. So I keep coming back to this, but I fundamentally believe it to be true. The tools are out there for people to take advantage of, but we've got to take advantage of them. Health cost brings transparency. We've expanded the health cost website to include prescription drugs, so we're trying to inject transparency into that area as well. Definitely using a broker. I advise using an agent or broker no matter who I'm talking with, because they have a more wide view of the overall market, and they have the ability to, as best as possible, try to put you into an arrangement that's going to be the best fit for your type of business and your employee makeup. So using those tools and advantages is going to be huge. I'll get a little bit off track just because Lucy knows how to get me fired up. The consolidation piece. I'll tell the story this way. One of the most frequent complaints that I get from consumers is that there are no plans or very few plans that have Boston hospitals in network anymore. And they asked me why that is. A couple of reasons. The first is, and Cass made this point earlier, when the Boston hospitals were in network, there were far too many people who were running down to Boston for things that were fairly routine in terms of care. They were not using the convenient MDs or those types of models. They were constantly going to the highest cost provider that could that was in their network. And so the carriers were losing hand over fist, having to pay the Boston hospitals for things that those individuals could have gotten for a significantly lower price here in New Hampshire at the same quality. So it was a huge cost driver for them. And the second reason is because the Boston medical system is highly consolidated. I tend to lose people here a little bit, but bear with me. I'm an old school free market capitalist. I believe that competition is a good thing. But in order for that to work, of course, you've got to have competitors who are out there competing against one another for people's business. And when markets get consolidated, you undermine that fundamental principle. And so the situation that you have in Boston, which is again highly consolidated with some of the highest costs in the country, is something that we're starting to see creep into New Hampshire, and is something that I am highly concerned about. Now, can you prevent it in all circumstances? No, because at the end of the day, I would rather have that hospital open and running rather than having gone out of business. But we all have to work together to figure out how we come up with a better model. And I'm going to work at the insurance department to collaborate and partner with the insurance industry in terms of being part of the solution. But the healthcare system too needs to figure out how it innovates in its model. How the hospitals figure out how to make their model more sustainable for the long term. Because the solution cannot be, as it has been, government give us more money to subsidize our operation. The carriers need to pay more and pay more and pay more to help us maintain our operation. Because when that happens, when you're expecting the insurance carriers to subsidize your model that may need innovation, updating, and efficiencies into it, that cost, of course, is going to trickle its way into the premiums, which drives up the cost for all of you and for your employees. So it's a very complex, multi-layered situation that we've got here. But we do have tools, we do have assets that we can take advantage of, but we've got to inject more of that into our culture.
So I'm sure you want to say something too. Who wants to say something down the line? I will interject that the benefit of being in Exeter and also the curse is that you all are in the Golden Triangle area where there's a huge amount of effort to consolidate and have as many of the businesses and employees who work in this area come to your medical center. So you're seeing a lot of that play out in this area and costs going up as a result, which is really tough because you don't get to choose who shows up as your provider and how they're managing that. It's a really important conversation to have. I think employers have a really strong role in being able to say, hey, this changed. We'd really like to see this for our employees in this community. We'd really like to see that. And they're responsive. They can be responsive in that regard. We often talk about how we're a state of 1.4 million people, and we spend over $13 billion on healthcare, and it's going up. Like, who is paying for that? And where's the conversation about what we are paying for and what we want to buy for our employees, what we'd like to see more of, what we'd like to see less of. So it's a really tough conversation, important. I want to find out a little bit more, this type of conversation where we learn from each other, what does that mean to you, Ryan, and what will you bring home from this? What would you like to hear from some of your colleagues?
I'd love to start the conversation today and then have it continue both in our offices and in our organizations, but with each other down the road. I think that we need to continue to talk about these things. I think we need to continue to highlight what the state has for resources in respect to the health costs out there. I think people need to take responsibility of their own health costs, and employers need to help their employees out in understanding their health costs, using some of the resources, using the people around them. And I think that's the biggest thing that we can take from this, is that there needs to be more clarity moving forwards. Healthcare in general is a very muddy situation where the costs sometimes are hidden. There's hidden fees, there's hidden reimbursements and such. And that needs to be more brought to the forefront, and we need to understand it as a group on a flat playing field moving forwards.
Who here has came here with a decision that they've had to make about healthcare or healthcare coverage that you can share or you have a question about? Anyone want to share their experience with their health coverage and decisions they're making for employees?
I guess.
Thanks, John.
It's just front and center because we've been in the process of like choosing and selecting a new plan, and our broker, Heidi, our new broker, is here today. She's been very helpful about it. But I think a big impetus for making the switch to a different broker was getting that notice in the mail through our business-owned health plan. It was an Anthem plan, and the premium was going up by like, I want to say somewhere around 15 to 20%. And that's crazy. And every year it's just gone up and up and up. And because we're a small company, we don't have the ability, I think, to buy into these larger, more cost-efficient plans. And so, paying $600 a month times 12, for so many employees, it starts getting to be out of control. So cost is driving the decision making, which is unfortunate. It should be the comprehensive nature of care. And so this is where, we've always had this tug of war, being healthcare in our own aspect. We're part of herbal medicine, so it's not quite mainstream healthcare, but we're in that realm, in that space. And a lot of our employees are like, well, so we should have access to some of the better benefits. And then I have this moral dilemma of like, how do I need to do better, but I can't provide it. And then when I got that letter from Anthem, that was kind of like the final straw, because seeing that 15 to 20% premium increase, I stayed up pretty much all night. I was like tossing and turning, and what do we do about this? And so cost is driving the decision. And I think I came here today because I'm trying to learn. I think knowledge is power, and we need to learn more about the situation in order to think creatively. And I like all the points that you guys have been sharing. I think they're very valuable. But I'm just trying to get information and see what is the sustainable way forward to provide the best level of care. So it's a big decision.
Has anyone else experienced that cost increase and then negotiated with their broker or managed to move their plan discussion to a better place?
My experience when I was doing this, my business no longer is doing this. I had a plan that I offered to my employees. They had better options through a spouse. So I was the only one populating the plan. When I turned 65, I went on Medicare, and the plan went away. Our business no longer has health insurance. Water Street Bookstore in downtown Exeter. But when we were doing it, it was a constant cost increases and choices about less benefits to offer. So it became less and less attractive as the cost went up, because I had to control the cost for my business. And this is a story that you've heard over and over again, I'm sure.
I think Dan brings up a very important point, is that you're really limited as a small business of what you can choose, and you'd love to provide the best possible plan for your employees, but that best possible plan is something that the business cannot afford to move forwards. And you look at all the options possible to provide that for your employees, and you settle on something that you're able to still survive with and still provide for your employees. And even that is still not competitive enough in the grand scheme of things moving forwards. And then those plans change year to year, so there's a lot of confusion.
They degrade, Brian. They degrade.
Yes.
They don't change, they degrade. What you're able to offer your employees is less than this.
Yep.
Or more.
And so I think that what Dan is talking about and his process that his business has gone through is very common with a lot of other small businesses where they would love to offer plans, but they are getting to a point where they can't offer anything at all for their employees. And yes, you can do stipends, but you have to do stipends for each employee. And then when you do offer a stipend, you get you're not able to achieve the best plans in the marketplace because there's penalties associated with that for the employee.
Just to finish, thank you, Ryan. Your point is, you sharpened my point, thank you. We've now hired a former community college instructor to serve as our HR person, and we execute a strategy of hiring high school and college students to fill the positions temporarily, because they're not with us long term. They used to be held by professional booksellers who worked with us, who were in their 30s, 40s, 50s. We even had one person in their 70s. We don't have those people anymore. We now hire high school and college students who don't require health insurance.
So the
And
face of your
that's how
business,
that's how we're coping. And she's great at training these people up very quickly and getting them up and running, and that's how we've dealt with this problem. And it's not great. I'm not proud of that, but that's what we were forced to do. I applaud the insurance commissioner's efforts to inject transparency, but I kind of feel like, and this isn't, I'm not casting aspersions at you personally. I kind of feel like you're putting your finger in the dike and trying to hold the water back. There's got to be some kind of fundamental shift here, because all these little things that we're trying to do to make it work, they're not working.
Right.
Sorry
And the
to
system
say.
is huge. It's a
Yeah,
big
so
force
that's the
of
elephant in the
water
room,
coming at
right? We can talk about manipulating and adjusting, and it's not working. And I'm sorry to be a despairing person, because I'm not normally a despairing person about this. And then the turbulence added at the federal government level in the past year, as it's the coup de grace to this whole system. And I see you nodding your head, Mr. Commissioner, so thank you for agreeing.
And just so we all level set, right? So we're facing whether or not the supports that were existent, in addition to the state's managing an incredibly important high-risk pool, subsidized high-risk pool for the individual market, we're going to see some real pressure on that, which will ripple across if there's not some solutions soon, which will ripple across. But we still aren't getting at the fundamental cost.
Can I say one last thing?
You can.
My costs as an individual accessing medical procedures has never been controlled more since I've been on Medicare. The federal government has the power to control costs in a way that no other entity does, if they choose to do it. Now, they do it with Medicare, but we can't do that with everyone else? That's the question.
Yeah, that is the question, which is,
Sorry,
and especially in New Hampshire, we have this idea that the free market's going to help us.
I've been a free market person all my life,
Yeah.
like you, DJ. And I don't think it will work in this case, because the forces working against a free and open market are so great and so entrenched.
Thank you for sharing that. I'm sorry that your business has radically changed its footprint.
We've never been more successful, and it's because we found this HR person who knows how to work with high school and college students and can get them trained up quickly, and they execute at a very high level, thanks to this one person.
Yes.
I wasn't going to say anything, but since you opened Pandora's box, I think
Yeah.
I'll speak
Tell
now.
us your name.
I'm Dr. Beltry, and I just opened a new practice that's a direct care practice. And so I want to talk about direct care, and I want to just share my experience from the healthcare side that I've spent 20 years hearing patients complain more and more, especially over the past couple of years, about how health insurance is not working for them and not covering the things that are meant to be covered. And it's not working for us either. It's not working for the physical therapists, it's not working for the physicians. And it's created a situation right now where a lot of people are leaving medicine. And there's a huge brain drain going on in healthcare. And I can tell you, I worked for Convenient MD for 10 years. And when I started, we were about 80% physicians, and I was one of the last two, and I left last month. And what's happening is a lot of not just primary care physicians, but also specialty physicians are leaving the health insurance, including myself, industry, because we see what's happening. Costs are going up, care is corrupted. And there are some benefits to direct care, particularly direct primary care. There's a lot of situations where employers, especially small businesses, can actually work with DPC doctors to have primary care, urgent care, and general medical services covered. Direct care physicians can negotiate with the LabCorps and the Quests and get good prices on labs and medications, and in a lot of cases, our monthly membership fees paired with a catastrophic insurance plan are a lot cheaper than a gold or silver plan, and you're gonna get a much better experience. And so I'm interested to hear what you guys think, particularly, Commissioner's talking about innovating, how that might fit into the future of healthcare, because I really believe that in my 20 years of practice, the system has gotten to a point where it's not sustainable.
That was a perfect lead into what I was about to say next.
Excellent.
To the gentleman over there, don't worry, I wouldn't last 5 minutes in this job if I took things personally. I get the frustration, believe me.
I appreciate your
Again, I'm going up to Carroll County to talk about Medicare Advantage after this.
But I do appreciate your efforts to inject transparency.
Absolutely. And to your point, when people say, well, free market capitalism, that's not solving the problem. To your point, well, have we gotten the forces out of the way that would actually get us to the type of system and arrangement that I have in mind when I say that? And the answer to your point is no. And we've got to figure that out. That's right. So to your point, I think that we do have to be willing to embrace new and innovative models. And direct primary care is such a model. To your point, you're going to have to pair that with some sort of catastrophic plan that will layer over that. But I'm also a big believer in new models such as association health plans, such as making multiple employer welfare arrangements more viable. Now, you have to be thoughtful in terms of how you do that. But I do think that to the extent that you can pave the way or clear the path for new and innovative models, it's not going to work perfectly for every business or for every individual, but it might work incredibly well for some small businesses and some individuals. You've opened up the market to a wider range of choice so that people have actual choices to make in terms of what is going to work best for them. And to your point, the federal government has not been helpful. I don't have a ton of positive things to say about what's going on in Washington these days. They are trying to get a little bit more aggressive in the transparency space. That's great. They're a decade behind. We can teach them a lot. They obviously have levers that can bring accountability in a way that the states individually do not. So I'll give them some credit for that. But one of the things that certainly could be very helpful is if they're able to provide more viability to association health plans or multiple employee welfare arrangements, in doing it in a controlled, thoughtful way, not trying to approach it by ramming administrative rules through, which then get bottled up in the courts, but actually having a thoughtful discussion around it, having it go through the regular legislative process, where there are compromises, where the kinks and the bugs are worked out, allowing the states to have more control over the environment in which healthcare and health insurance operates, I think is a huge benefit. Lucy talks about our reinsurance program. It's been a huge success. Since implementation, our premiums in the individual market have decreased 18 to 20%, depending on the plan. And I think the biggest message out of that success story that I have for Washington is trust the states to design systems that are going to be effective for their populations. And so that's a huge part of the message that I really emphasize when I'm talking to our federal delegation, or I'm down in Washington talking to CMS or other entities of that nature. Give us some ability to innovate and to be flexible.
And federal government, who does have a ton of control, please help us by doing the right thing. And yes, one last question, and then I'm going to have each one of you say some farewell comments.
I don't have a question necessarily, I have a comment, but I do think it's a worthwhile comment. So my name is Ellen Risk, I'm the Assistant Director of Student Services here at SU 16. And something that's on my mind and that's really relevant to us is the fact that it was already really challenging to find mental health care for kids, especially psychiatry, but also even general counseling. And there were very few providers that take Medicaid. And now what we're faced with is that there are very few providers who take insurance, period. So it's becoming inaccessible for kids and families to access mental health care in a critical time of need. As we all know that, the levels of anxiety and depression have soared in the last several years. And so it's a really challenging time to get our kids and families the help that they need. So just more of a comment and something for us to think about. Again, I don't have the solution, or I don't have a question, but I do think it's a pressing problem for everyone.
Right. And we could talk a long time about why we don't. We have managed successfully over some past few years to try and get more resources to the mental health delivery system, but it is a constant battle.
Yeah.
It's much more fun to develop a cancer care center than hire a lot of therapists. Yes.
I have a question. I just have a quick comment. My name is Karen Winham, the Economic Development Director of the town of Exeter. And first off, just where'd you open shop?
When?
Where?
Oh, my office is in Epping, but I also do home visits.
Okay, excellent. We have space in Exeter, just saying.
All right, I love that.
Okay. For the commissioner and first off, thank you Chamber for doing this, because this is an eye opener. So I maintain the Secretary of State's business in good standing list for 900 businesses in Exeter. I will be sending out, Commissioner, the health cost website, which I just looked up, wasn't aware of it. I'll get that to all my businesses. But the Secretary of State, it allows the Regional Planning Commission to get that for each county. So if you have a message, or if there's a collective that is a group and you want to get this stuff out, we can get it out for you.
Awesome.
To all the businesses in the state.
And your name?
Darren Winham.
Darren Winham. Wonderful. Thank you.
We
That's
will be in
really
touch.
helpful.
Awesome.
Because there are a lot of resources that we can help make available around these decision-making, what driving some of the health costs, where you can be vocal, how you can help each other. I think that's the theme of today, that there are lots of places in the decisions you're making. You are facing a multi-billion-dollar health system that we can't solve that problem. There's a lot of innovation that we need to encourage. A lot of force needs to be put to bear, some from the state, some from the feds, some from you all, in terms of the questions you ask and the resources you need and the information you share. Hugely impactful. Hard to do, but hugely impactful. So it's so important that we collaborate, and so grateful to the Chamber for bringing us together. But Cass, Ryan, Commissioner, Deb, just final words of wisdom as we approach 10:30 to your colleagues in the room.
I don't really know that these are pearls of wisdom, other than just to say, love the conversation, love being part of the conversation, and I think we need to keep it going. I think one of the benefits of New Hampshire is we have always gone grassroots. We are not afraid to dig deep. We are not afraid to get the work done. So I would love to keep the conversation going, and hope we can do that.
I'd like to thank the Exeter Chamber of Commerce and the New Hampshire Health Initiative for starting this conversation. I think we need to continue this conversation. Having more conversations like this across the state is going to be very important for the health of the state. And I feel like the survey is well representative of what the small business community is feeling right now. Health costs are up, coverage is down, value is down, and the playing field is tilted towards larger corporations and monopolies associated with the state, and that's something that needs to change, and I believe that the changes within the independent and smaller businesses, healthcare providers that can provide care, the same quality of care at a lower cost.
Thank you, Brian.
So I would just emphasize how much I appreciate the opportunity to collaborate and partner. You know, Lucy and Deb are doing great work, but the opportunity to obviously hear from you and to work with you is so important, as I've mentioned a couple of times. To tackle the significant challenge that's ahead of us, it's going to take some participation and some teamwork here. And so keeping these lines of communication open, having forums and dialogue of this kind, I think is so important. The other thing I would emphasize is, again, use the tools that are available to you. And we at the department put a lot of time and effort into providing a lot of information and a lot of data and analytics right on our website. We do a lot of different programs. We try to be attentive to the issues and the challenges that are at the forefront of the markets. And so we'll do webinars, we'll do podcasts, we'll do symposiums. And it's not just me up there going on and on. We bring in bona fide subject matter experts, both within the department and outside the department, to lead those discussions, and they can answer a wide array of questions. And so take advantage of the resources that are out there. We as a department are obviously available. I believe that there's information about the department on each of the tables. There's a lot of good stuff there. I'm confident in that. But if there are questions or concerns that come up, do call us. We can either provide you with the answer, we can get you off to a good start, or we can tell you where you should go to get the particular information that you're looking for. So please continue to provide us with the information in terms of what you are seeing, so that we know where we need to focus our time and attention as we're trying to tackle a lot of these issues.
Thanks, Commissioner. I want to reinforce the message of stay engaged. You are not alone. Small businesses all across the state, and honestly all across the country, are experiencing the same trends that you are. And the Health Cost Initiative is looking for repeated and continued engagement with the business community to really plumb the depths of what the experience is, and then to really explore what the tools are. I have just fascinated by the conversation this morning about the push away from insurance and the need for care that exists that is pushing up against that trend. And at the same time, the great need for competition and almost at the same level, collective effort in the same direction. There's ongoing efforts to really think about what does transparency and accountability and oversight mean in a small state like New Hampshire that could really produce effects for everyone struggling with these same circumstances. So really encourage you to look for information from the New Hampshire Health Cost Initiative, to remain engaged in its employer and healthcare conversation, because I think in the true New Hampshire sense of it's that public-private partnership that is going to make the changes that we need, and we're small enough that you can get everybody around the table and everybody is invested, because despite what the commissioner has said about it being a free market, you can choose not to buy a TV or a refrigerator, but when the moment happens, when someone in your family or in your circle or you yourself need healthcare, it feels in no way optional, right? And so it's a really, really complex situation, but stay engaged, because that is the way that New Hampshire does what it does best, which is to find the really practical solutions that are homegrown and tailor-made for these circumstances. Really appreciate your time today.
So well said, and thank you all. We feel your pain, but also your inspiration and what you're able to accomplish every day, so really appreciate your being here. You know, I think at the Health Cost Initiative, we really believe that, you know, if bad things are happening, it may be because someone didn't ask the right question. And so we are raising that question. Why are our health costs so high? What can we do about it? That doesn't mean, you know, we really want to have shared accountability around this. with everybody participating in the healthcare system, because shared accountability means not just blaming the usual, entity, not pretending it's not happening, and not being sort of blind to solutions. You all have to make your business decisions every day. We need to help you and provide you resources to let that question be asked so you have some ability to survive into the future with a business plan that makes sense in your community. So we're trying to ask the tough questions. We really appreciate what you are sharing for your experience, and the Chamber for hosting this conversation. We hope you take something away from it. You've taught us a lot, and we really appreciate your time here this morning. So introduce yourselves to us after. We'll be here for a little bit, and thank you so much.
Just two quick things. One, thank you again to our speakers and our panelists. Sorry, I just choked as I was walking. Thank you for taking the time and for being open to such a thoughtful discussion. Thank you to all of you for attending and for bringing your questions and your comments. It really is an important conversation, and we're glad that you're here. If someone wants more information on the New Hampshire Healthcare Cost Initiative, they can go to
NewHampshireHealthCostInitiative.org, but maybe you'll give us the list and we can send a follow-up email to everybody with resources that were identified.
Thank you to SST for hosting us, and thank you to Exeter TV for recording today's program, so it will be available on their YouTube channel to continue the conversation. There's plenty of food left. Please help yourself before you go, and have a great day. Thanks, everybody.